Hi everyone, I'm Dr. Serena, and today I want to discuss a topic that doesn't get nearly enough attention, and that is mammary cancers in sugar gliders. Recently, a client asked me why her sugar glider developed this type of cancer, and why veterinarians are not educating clients on this. It's a fair question, and the answer involves both veterinary care and responsible breeding practices. Sugar gliders are kept as unique pocket pets, most likely because of their undeniable cuteness. However, many owners don't bring their sugar gliders to the veterinarians regularly. This is a significant problem because, like all animals, sugar gliders can develop health issues, including cancer. Mammary cancer in sugar gliders is considered rare, but in my professional experience, I have seen 3 intact, non-breeding female gliders in just the past 2 years with mammary tumors. I suspect this is actually an underdiagnosed disease, and perhaps many gliders are passing away without a necropsy to confirm the cause of death. The development of mammary cancer in sugar gliders is often linked to their natural reproductive cycles. Each heat cycle sends hormonal signals to the mammary glands, essentially preparing them for offspring. However, when a female is not bred, these glands undergo a process of cell turnover in which every time cells divide, there is an opportunity for genetic mutations. Over time, this repeated cycle of preparation and renewal can lead to the formation of lumps. With enough mutations, these lumps can evolve into aggressive cancer cells. Unfortunately, unlike in other pets, spaying is not a practical solution for sugar gliders. Their reproductive anatomy is highly complex, featuring bifurcated uterus and paired vaginas, which makes surgical intervention extremely challenging. As a result, intact females continue to cycle, perpetuating this cycle of cell turnover and increasing the risk of mammary cancer. Case reports have documented anaplastic mammary carcinoma and metastatic mammary adenocarcinoma in sugar gliders. These cancers can be aggressive. In one instance, a sugar glider presented with a rapidly growing mass near the mammary gland that required surgical removal and intensive follow-up care. Unfortunately, the prognosis is often poor. Early detection is critical. In another report, 2 sibling females presented at 9 years of age with no visible metastasis. Both underwent pouch ablation and radical mastectomy. Despite these efforts, one developed metastatic pulmonary nodules and had to be euthanized within 6 months of diagnosis. The other developed a completely different type of cancer 13 months later, ultimately leading to euthanasia. Sometimes there are no obvious signs that the sugar glider may be losing weight. Owners might notice that their glider is excessively grooming their pouch or see a change in coat color around the pouch. These subtle signs are often mistaken for pouch infection, leading to home remedies that may delay proper diagnosis and treatment. The primary treatment for mammary carcinoma in sugar gliders is surgery, specifically a radical mastectomy, basically removing the entire pouch. However, before proceeding with surgery, it is crucial to screen for metastatic disease. This involves imaging and possibly blood work to determine if the cancer has already spread. If metastasis is present, surgery is not recommended as it would not improve their quality of life. In cases where cancer has spread, treatment shifts to palliative care. And this includes pain management, monitoring their quality of life, and providing supportive care. If the sugar glider is losing weight or experiencing difficulty breathing, humane euthanasia may be the kindest option to prevent suffering. A concerning factor is the inbreeding that often occurs to produce specific color variations, such as the cremino and leucistic sugar gliders. Breeding for these unique appearances can lead to higher risk of genetic diseases, including cancers, or at least the predisposition to cancers. This situation is similar to what we see in other species. For example, white-coated dogs like boxers can be prone to congenital deafness. The merle color pattern, often seen in breeds of Australian shepherds, is linked to ocular deficits. So these examples highlight the dangers of prioritizing appearance over health, and it is a mistake that can have serious consequences for our pet. And this brings us back to the question of why veterinarians aren't educating clients about this. The truth is, most veterinarians would love to provide this education. However, many sugar glider owners never bring their pets to the veterinarian for routine care. The information needs to start with breeders and pet stores, who are often the first point of contact for new sugar glider owners. They should educate about the importance of regular veterinary checkups and monitoring for signs of illness. In my experience, sugar glider owners are extremely dedicated to their pet's health. They do their own research. They read every single entry in the glider forums, and they follow the suggestions of their breeders. Unfortunately, this often leads to heartbreak when their female gliders develop mammary tumors or pyometra, or other diseases like paracloacal sac impactions and dental disease. If you own a sugar glider, it is important to remain vigilant for any changes in your pet's health. Regular veterinary visits are essential to catch issues early. And if you notice any signs of illness, no matter how subtle, please consult a veterinarian. And if you're a breeder or work in a pet store, please take the time to inform new owners about the importance of veterinary care. This small step can make a huge difference in these pets' lives.